Hello, everyone, and welcome to Introduction in the U.S. Healthcare System. This is our discussion of Chapter 3, which looks at the evolution of the U.S. healthcare system from the 1800s through present day. And the reason why this chapter is so important, and actually why I've decided to address it in the first week, is that it's very difficult to understand how far we've come in the U.S. healthcare system and how we came to be where we are today unless you have some sense of the historical context in which we are providing healthcare today. So Chapter 3 goes through a very detailed history of all of the various scientific developments as well as professional developments in healthcare of the last 200 or 215 years or so. And so what you're going to learn about today is looking at the developments that have happened over the years and really gain some insight into why it has been so difficult in the United States for us to achieve universal access to healthcare. And we're going to talk about the various attempts that have been made to get universal access to healthcare in the United States and how those attempts had failed up until recently. So this will give you a historical perspective on what we're going to talk about next week that relates to health policy and the Affordable Care Act. So healthcare in America has had a troubled past. Since the 1800s, there have been multiple times where the United States government has tried to get a universal healthcare system. Because there wasn't sufficient political will, because of the demographic makeup of the United States at those times, it wasn't possible to get a national healthcare system. And instead, political compromises were made to cover select populations that were particularly deemed of being in need of support or social assistance. And so we're going to talk about all of those various compromises that have happened, mostly focusing on the 20th century, that have brought us to where we are today. As you probably know, the Affordable Care Act, which was passed in March of 2010, was passed without broad consensus or support from Americans. But there was consensus and support within the healthcare industry, within the health insurance industry, and amongst political leaders that the U.S. healthcare system was broken, that it was not going to be solvent if it continued on the path it was on. So politicians and political leaders and the industry realized that something needed to change, even though most Americans weren't in support of those changes, in large part because they didn't understand, given the complexity of the U.S. healthcare system. This lack of previous ability to make change in the U.S. healthcare system and also the lack of current consensus around the Affordable Care Act is part of the reason why most analysts think that the Affordable Care Act is still in jeopardy. Even though it's been around for 5 years and significant improvements have been made, we know